Graduate Medical Education resides at the heart of healthcare at Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Each new doctor, armed with the knowledge they gained in medical school, gradually learns how to tap that knowledge to provide the community with patient-centered care.
I remember starting as a resident here in 1984. I remember starting and being absolutely scared to death.
My first day of residency, the feeling that I remember the most was scared. Understanding that the day had a beginning but not necessarily an end.
I first stepped into this hospital on June 30th of 1970, and I clearly remember this mesmerizing, glamorous building sitting in the corner of Osborne Terrace and Lyons Avenue.
I began at Beth Israel in June 1st, 1950. The total intern staff, resident staff, was 12 people. There were 4 residents in surgery, and we had 600 patients. So we were overwhelmed with work, and we worked every other night and every other weekend. So my first impression was hard work.
In a word, frightening, and as a secondary word, because of the people that were around, that I was surrounded by, comforting.
I was sitting in the intern's office, scared to death that the nurse would actually call me to actually see a patient and make a medical decision. Scared to death. And an hour or so into this, the nurse knocked on the door and said, Mr. So-and-so down the hall is having a problem breathing. And I went down there, feet trembling, but when I got to the bedside, I became a doctor.
The nurses were very nice, and I'm sure I had a huge amount of anxiety, and I realized that medical school was over, that I was a full-fledged doctor and I had to do my job and do it well.
The path to becoming a doctor is a journey, not a destination.
In December? Okay, so some of the ones that you had...
One of the ways that you become a professional is a commitment to lifelong learning. You do lifelong learning in an institution that promotes and encourages it. Newark Beth Israel has had a tradition of this for the entire 110 years of its history.
The primary care physician is the portal through which patients' care is first accessed.
It's the primary care physician who sees the child first. Unless the physician is trained how to recognize a diagnosis, they won't be able to identify.
A vibrant graduate medical education program ensures that multiple disciplinary care is available around the clock.
Both within the hospital and to our community, our residents with supervision are providing minute-to-minute, 24-hour-a-day care to the patients in this hospital.
Well, I think that the presence of a residency training program here really enables us to keep everybody on their toes. You know, the faculty, the residents, the ancillary support staff are really challenged to keep up to date in their medical knowledge.
Many of the doctors trained at the Beth use their training to care for patients around the world. Others choose to stay and serve the community.
We've had about 40 residents in vascular surgery who have finished the program here. About 15 of them still practice in the area.
Clinical research is a vital component of graduate medical education. More than 2,000 clinical research projects have been conducted by Beth physicians and residents, leading to enhanced diagnosis and treatments and giving rise to the latest innovations in medical technologies.
I think clinical research just enhances the training program.
The clinical research that you asked about is probably the most important contribution to medical care.
The ability to do research, to be exposed to research, to understand how to read research, is the way that you continue to perform the duty professionally of lifelong learning.
Clinical research is extremely important, especially in a community like ours and across the nation as well. It provides an opportunity to not only improve patient care, but patient satisfaction.
In reality, we are training the physicians that will take care of us and take care of our families in the future. And having well-trained physicians who understand the importance of the health of a population, to understand and embrace evidence-based medicine, again, are invaluable.
At West Point, they talk about the long gray line, which is the connection from the very first cadet at the beginning of the academy, at the beginning of the country, through the present and into the future. In medicine, it's the same thing. It goes back to before Hippocrates, when the first doctor became aware that there was something about human suffering that attracted their caring. We have now the responsibility to hold this, to nurture it, to improve it, and to pass it on to the next generation. It's done in a vessel, the vessel that encourages and creates the environment for quality in care and in education. One of those vessels is Newark Beth Israel Medical Center.
One new doctor trained at the Beth will eventually care for an average of 5,000 patients a year and 200,000 patients in a career. Over the course of a lifetime, one graduating class will touch the lives of more than 2 million men, women, and children in the community, the state, the country, and even throughout the world.
I'm gonna come back.
Am I gonna get an injection?
No. You're just gonna see the doctor. You're gonna speak to him. You're gonna tell him everything that's wrong with you, okay?